My name is Dr. Kohilan Gananandan, and I'm a Senior Hepatology Registrar, and I'm an investigator working in the COMBAT trial. I work at the Royal Free Hospital in London. The objective of the COMBAT trial is to evaluate the effect of a new combination of two well-known drugs, namely albumin and an anticoagulant at low dose called enoxaparin, in patients hospitalized because of complications of cirrhosis. If positive, this study will contribute to reduce complications and hospitalizations related to cirrhosis and improve the quality of life of patients. Patients will be randomly divided into two groups. The control group will receive the standard treatment prescribed for their disease. The other group will also receive albumin and enoxaparin on top of their current medical treatment. Albumin will be infused via peripheral vein in about 60 to 75 minutes every 10 days in an outpatient clinic. Patients will be injected with enoxaparin once daily below the skin with a very thin, small needle, like diabetics do with insulin. Patients will be treated for 3 months and then followed for an additional 3 months. All patients with cirrhosis almost ready to be discharged from the hospital after an acute complication of the disease will be evaluated by the investigators to assess if they can be included in the study. In this case, the physician will provide very detailed information about the study and ask the patients for signing of the informed consent form. Of course, only if they are willing to participate. Both albumin and enoxaparin are currently and frequently used in patients with decompensated cirrhosis. We do not expect significant side effects from this combination of therapies. However, as for any blood product, there is a minimal risk of allergic reaction when albumin is infused for the first time in a patient. Regarding enoxaparin, there is a potential risk of bleeding, but with the very low dose used in this study, the risk is extremely low. Personal information will be anonymised and privacy fully protected according to the UK and European legislation. As for any clinical study, the patient can withdraw from the study at any point without having any negative impact on their future clinical management by physicians. Patients will receive all other necessary drugs for the treatment of cirrhosis. The combination therapy is given in addition to the best current available treatment. Our centre is the Royal Free Hospital in London in the UK, and the other centres include Barcelona and Madrid in Spain, Münster and Aachen in Germany, Bologna and Turin in Italy, and Paris in France.